So hey friends, today we are going to revise thyroid gland. Okay, the thyroid gland is the largest endocrine gland of the body. Three hormones produced by it are T3 thyroxine, T4 tetrahydrothionine thyroxine, and calcitonin. Thyroid cartilage, thyroid gland, trachea, sternum, and clavicle. Important functions of these hormones regulate basal metabolic rate, stimulates the psychosomatic growth of body, play an important role in calcium metabolism. Specific features of thyroid. It is only endocrine gland which is located superficially in the body, thus can be examined physically. It is the only endocrine gland that depends on external environment for raw material, that is iodine. Only gland that stores its hormone. It is one of the organ of the body having a very rich blood flow. Location. The thyroid gland is located in lower part of the front and side of the neck opposite to C5, C6, C7 and T1 vertebra. Parts and features. It is edge-shaped and consisting of two lobes and a horizontal isthmus connecting them. Each lobe of a gland extends upward to the oblique line of the thyroid cartilage and below up fifth to sixth tracheal ring. Sternocleidomastoid, thyroid gland, and trachea. The isthmus extends across the midline in front of second, third, and fourth tracheal rings. Hyoid bone, thyroid cartilage, levator glandulae thyroidae, cricoid cartilage, pyramidal lobe, first tracheal ring, lateral lobe of thyroid gland, isthmus of thyroid gland, fifth tracheal ring, C5, C6, C7 and T1. Weight about 25 grams. Each lobe is 5 cm long, 3 cm wide, 2 cm thick. Isthmus is 1.2 cm by 1.25 cm. Capsule of thyroid gland. Two capsules, an inner true capsule and outer false capsule. True capsule formed by fibrous stroma of gland and false capsule formed by splitting of pretracheal fascia. Outer false capsule is formed by pretracheal fascia and inner true capsule is formed by fibrous stroma. Some features of false capsule are: it is the thin along the posterior border of lateral lobe. It is thick on medial surface. One medial surface it thickens to form suspensory ligament of Berry which connects the lobe to cricoid cartilage. Clinical. Sometimes the thyroid tumor extends backward as the capsule is thin along the posterior borders of the lateral lobe, compressing the adjacent structures without forming a visual swelling on the front of neck. The thyroid glands move up and down during swallowing because its capsule is attached to laryngeal cartilages and hyoid bone, which moves up and down during swallowing. Thus, swellings can be distinguished clinically from other swellings in the region of the neck. Thyroid gland, thyroid veins, true capsule, venous plexus, false capsule formed by pretracheal fascia and true capsule by fibrous capsule, plane of cleavage. Relations. Each lobe is roughly pyramidal, apex and base. Two borders, anterior and posterior, three surfaces, lateral, medial and posterolateral. Apex directed upwards laterally, sandwiched between inferior constrictor medially and sternothyroid laterally. Base, it extends up to fifth or sixth tracheal rings related to inferior thyroid artery and recurrent laryngeal nerve. Muscles attached on oblique line of thyroid cartilage, thyrohyoid, sternothyroid and inferior constrictor, outline of lateral lobe, thyrohyoid muscle, superior thyroid artery, external laryngeal nerve, inferior constrictor, lateral lobe of thyroid gland, sternothyroid, thyroid cartilage, cricoid cartilage and tracheal ring. Lateral surface convex and covered by three steps muscle, sternothyroid, sternohyoid, superior belly of omohyoid, Anterior border of sternocleidomastoid overlapping it inferiorly. Medial surface, two tubes, trachea and esophagus, two muscles, inferior constrictor and cricothyroid, two cartilages, cricoid and thyroid. Posterolateral surface, carotid sheath and its contents, common carotid artery, internal jugular and vagus nerve. Vagus nerve, superior laryngeal nerve, internal laryngeal nerve, superior thyroid artery, external laryngeal nerve, thyroid cartilage, cricoid cartilage, trachea, esophagus, inferior thyroid artery, recurrent laryngeal nerve, inferior constrictor, cricothyroid, two muscles, two cartilages, two tubes, anterior border, thin, related to anterior branch of superior thyroid artery. Posterior border, it is thick and rounded, related to longitudinal arterial anastomosis between superior and inferior thyroid arteries. Parathyroid, anterior and posterior. Describe the gross feature of thyroid gland. Each lobe of thyroid gland is pyramidal in shape and has apex, base, three surfaces: lateral, superficial, medial, and posterolateral. Two borders, anterior, posterior. Isthmus of thyroid gland has two surfaces, anterior and posterior, two borders, superior and inferior. Anterior apex, thyroid cartilage. Anterior border, lobe, isthmus, lateral superficial surface, base, superior border of isthmus, anterior surface of isthmus, inferior border of isthmus, inferior parathyroid gland, trachea, posterolateral surface, medial surface, arterial supply, superior thyroid artery supplies upper one-third of lobe and half of isthmus, inferior thyroid artery supplies lower two-thirds of the lobe and half of isthmus. Thyroid ema artery, 30% cases direct from arch of aorta. Accessory thyroid arteries from trachea and esophageal arteries. Venous supply, superior thyroid vein drains into internal jugular vein. Middle thyroid vein drains into internal jugular vein. Inferior thyroid vein, left brachiocephalic vein. Superior thyroid and middle thyroid into internal jugular vein and inferior thyroid vein into left brachiocephalic vein. Thyroid vein of Kochner, sometimes internal jugular vein. Superior laryngeal nerve, external laryngeal nerve, recurrent laryngeal nerve, external carotid artery, superior thyroid artery, anterior branch, posterior branch, thyroidema artery, inferior thyroid artery, thyrocervical trunk, subclavian artery, arch of aorta, medial thyroid artery, Kochner's vein, right brachiocephalic vein, left brachiocephalic vein, inferior thyroid vein, internal jugular vein, superior thyroid vein. Lymphatics, divided into upper and lower group. Upper group drains into prelaryngeal and upper deep cervical lymph nodes. Lower group, pretracheal and lower deep cervical lymph nodes and group of lymph nodes along recurrent laryngeal nerve. Lower part of isthmus, brachiocephalic nodes. Superior deep cervical, inferior deep cervical, submental, submandibular, prelaryngeal, paratracheal, pretracheal, prelaryngeal nodes, posterior belly of digastric, jugular-gastric nodes, nodes along the recurrent laryngeal nerve, pretracheal nodes, jugulo-omohyoid nodes, recurrent laryngeal nerve, inferior belly of omohyoid, retrosternal brachiocephalic nodes. Nerve supply, parasympathetic supply vagus and recurrent laryngeal nerve and sympathetic supply cervical sympathetic ganglia. Clinical, goiter, any enlargement of the thyroid gland except that during menstruation and lactation is called goiter. It may be associated with hypofunction or hyperfunction of the gland. Hypothyroidism occurs when there is insufficient secretion of the T3 and T4. The decreased level of T3 and T4 causes increased secretion of TSH. Here you can learn that decreased level of T3 and T4 causes increased secretion of TSH. So there is negative feedback regulation. Hypothyroidism causes creatinism in children and mixed edema in adults. Creatinism in children and mixed edema in adults. For details, see General Anatomy by Bisram Singh. Hyperthyroidism or thyrotoxicosis occurs due to excess secretion of T3 and T4. The thyrotoxicosis clinically presents as tachycardia, tremors, and systolic bruit. The main effects are due to increased BMR, simple goiter or puberty goiter. It is an enlargement of the thyroid gland without signs of hyperthyroidism. It occurs due to deficiency of iodine in diet. Remember, iodine is essential for synthesis of thyroid hormone. The decreased level of T3 and T4 leads to increased secretion of TSH from the pituitary gland. The TSH causes hyperplasia of the thyroid gland. Simple goiter commonly occurs in females at the age of puberty, hence it is also called puberty goiter. Effects of massive enlargement of the thyroid gland. The thyroid gland can enlarge backward or downward, but it can't enlarge upwards due to attachment of its facial sheath and sternothyroid muscle to the thyroid cartilage. It can't enlarge upwards because attachments of its facial sheath and sternothyroid muscle to the thyroid cartilage. The backward enlargement is common because the thyroid capsule is relatively thin posteriorly. In backward enlargement, the gland buries itself around the sides of trachea and esophagus. This results in three characteristic pressure symptoms, which dyspnea, difficulty in breathing due to pressure on trachea; dysphagia, difficulty in swallowing due to pressure on esophagus; dysphonia, hoarseness of voice due to pressure on the recurrent laryngeal nerve which lies in tracheoesophageal groove. Mnemonic 3D: dyspnea, dysphagia, dysphonia. The downward expansion behind the sternum is called retrosternal goiter. It can compress trachea, leading to dangerous dyspnea. This is all about thyroid gland. Thank you.